the anterior cruciate ligament is one of the main stabilising ligaments in the knee. It has a couple of important roles. One of those is to help with resisting translation, so the shin bone moving forwards on the thigh bone. It also supports rotation, so again, when you plant your foot, it's there to support us as we go into rotation. And the other part is it gives us feedback to the brain about where your knee is in space, and all of that can be disrupted when you injure this part of your knee. ACL injuries tend to happen playing sport. They normally happen when there's an opponent. Actually, more often than not, they happen in non-contact environments. And most of the time it's a planting, stepping manoeuvre where there's a pivot or a cut or a change of direction after deceleration. Imagine going around someone, you plant your foot, try to go around them, and that's when the injury tends to happen. With an ACL injury, there's normally a defined injury moment, so the patient normally knows when it's happened. They normally feel pain at the time. There's normally swelling that occurs quickly, normally within the first 24 hours. The patient most of the time will feel that the knee has changed, like it feels unstable, unsteady, feels like it might give way. At the time, they often feel something like a pop or a tear, or they feel something has happened inside their knee. Their knee feels different. And one of the main things to be aware of is often they can't continue. It gives you a good sense that something significant has happened inside their knee. Okay, so the road to recovery, initially, they need to have that knee examined, normally by a consultant or in A&E, for instance. They should have imaging. If we suspect an ACL, they should have imaging. And then from that, really they need to be starting with physiotherapy or rehabilitation as soon as possible. Ideally, you'd be doing that within the first few days or few weeks, really. The first bits are quite slow though. Get rid of the swelling, get the pain down, get them moving their knee, and then gradually, often within the first few weeks, the knee can start to feel a lot better if they're doing the right rehab. But this is a months, not weeks type of injury. Often it can take anything to 12 months from surgery, if they're going to have surgery, to returning to sport for sort of a layperson. The elites do it a little bit quicker, but their environment is obviously significantly different. They're paid to rehabilitate. But realistically, it's not about the time, it's about them passing all the markers they need for rehabilitation. And you should not be returning to sport unless you've had significant testing, everybody's confident that you've passed all the markers that you need to, and then a graduated return to sport. It doesn't always have to be surgical intervention. There are some things that would push us towards people potentially having surgery. Normally that's bigger injuries that encompass more aspects of the knee. If you have an isolated ACL injury or smaller grade injuries to those other aspects, then it may be that you turn out to be what is often termed a coper. That means you can cope without your ACL. We can't definitively say you will or won't be until we begin the rehabilitation process and we observe how your knee responds to the physical demands that we place upon it. But what we try to do is counsel them on what we might do if you go into one of those boxes. If you're going to be a coper, this is how we're going to go about rehabilitating. If you're struggling, then we'll onboard a surgeon and try to get their opinion and then plan rehabilitation as a result of that. But it is best practice to have around 6 to 12 weeks of rehab pre-surgery, even if you're going to go for it. But absolutely, we're learning that not everyone needs surgery. People will often get back to all aspects of their lifestyle, i.e. normal daily activities. You definitely should expect to get back to all your normal daily activities. You should expect that running and cycling and straight line activities have no problems, and you should be able to get back to those as long as your rehabilitation goes along the normal path. And with regards to sport, it very much depends. Around 70% of people get back to their normal activities. If you're playing at an elite level, you've got a much higher chance of getting back because of the support systems around you. If it's your first time ACL, you've got a better chance than if it's a revision. And sometimes people choose to change what they want to do. You know, often you've had a big injury that's affected you for a significant period of time. People decide not to go back to skiing or football, and that's okay. But our aim is to get you back to everything that you did before, and hopefully make you even more robust and perhaps stronger, fitter, faster than you were before, so that you're able to get back to that sport and hopefully feel even more confident.